Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health, reporting for the week of May 5th, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. This week is Asthma Awareness Week, so I will be going over COVID and adult-onset asthma, and I'm pleased to be joined by my co-host for today, Monique Campbell, who is Clinical Programs Manager at Roots Community Health, and one of those clinical programs is asthma. But first, I will provide a status update on respiratory viruses as well as measles. Taking a look at respiratory viruses among patients who present to a healthcare setting for testing. Flu cases in the bright blue line continue to come down. So right now, the largest share of cases is made up of rhinovirus enterovirus in the gray line. That's followed by human metapneumovirus in the black in terms of percentage of cases, and those are all continuing to go up. And of course, we don't have any specific treatments for rhinovirus, enterovirus, or human metapneumovirus. But right now, folks presenting for medical attention with respiratory illnesses are currently more likely to have one of those. But even though flu in the bright blue and COVID in the red are causing a smaller share of respiratory illnesses that are causing people to seek care, they are, of course, causing some. And it's still important to find out if what you have is COVID or flu, especially for those who would receive treatment if they're positive, also so that you can take other proper precautions. And right now, with the COVID and flu burden being relatively lower compared to other times of the year, I think it's helpful to look at epidemic trends. And this is where modeling is used based on emergency department visits to determine whether cases seem to be going down or up or staying the same. It's kind of an early warning system. And we can see that Utah in the lighter purple color means that COVID is likely growing there, and Hawaii in the darker purple, COVID is growing there in Hawaii. And pretty much everywhere else, most of the rest of the country is gray, staying the same, or shades of green, which are decreasing or likely decreasing. And the white is either just where it was not estimated, or information was incomplete, or it was just too small of numbers. And taking a look at the influenza epidemic trends, we can see that when it comes to flu, there's really not much to see here. The gray, again, not changing. Light green means likely decreasing. Dark green means it is decreasing. So basically, it is not growing anywhere in the United States at this time. So unless something very out of the ordinary happens, we probably won't be really looking at this again until the fall. And taking a look at hospitalizations from COVID, flu, and RSV. Flu hospitalizations in blue continue declining as expected, and those flu hospitalizations crossed below the COVID hospitalizations, which is in orange. That happened around April 5th, so about a month ago, and has been decreasing since. So we'll continue to experience the burden around COVID hospitalizations, but flu is heading down to zero. RSV is just about there already, and COVID is kind of cruising along, and we'll be waiting to see what happens next. Along the same lines, when we looked at viral respiratory deaths, so those from COVID, influenza, or RSV, but we can see just by looking at the overall curve that it's coming down considerably for all of these. In fact, right now, only about 1% of total deaths are from these causes. But because flu deaths are coming down so significantly, COVID now makes up a larger share of this, about double what we're seeing from flu. So about double the amount of COVID deaths compared to flu deaths at this point. And just like we've seen in every year since the pandemic started, there will be months and entire waves that are pretty much all orange, meaning all COVID deaths, where we would see that the vast majority of deaths from viral respiratory causes are from SARS-CoV-2 pretty much every other time of the year except for during flu season, which thankfully appears to be in the rearview mirror at this point. And a good thing is that COVID deaths are also coming down. So there have been 378 COVID deaths recorded for the week ending April 5th. We know that number may continue to creep up a little as more death certificates are recorded. But 378 deaths so far for the week ending April 5th. Now, the lowest number of deaths from COVID that we've had in any single week since this whole pandemic got started was last summer, the week ending June 8th, when we had 314 deaths. So that will be great if we can break that record this year and go lower and hopefully stay lower this year. Unfortunately, last year, that low point was then followed by a very significant summer wave where we ended up with over 1,000 deaths per week for a couple of months. So we really want to do better this summer. We don't want to get slammed again with a lot of COVID, and particularly with the hospitalizations and deaths. And so we should definitely be thinking about those who should be on the twice yearly vaccination schedule, and they should be getting that second dose before we head into the summer wave, certainly before traveling or doing any high risk activities. And so that is going to be folks over 65, those with underlying conditions. And of course, timely testing and treatment reduces the risk of hospitalization and death. So getting quick access to tests and treatment is key. And a quick update on flu. So cases and hospitalizations continue to be recorded, but are definitely coming down. Unfortunately, there were another 18 pediatric deaths added since I reported 2 weeks ago. So 216 pediatric flu deaths. This is way too many children lost to what is in large part a vaccine preventable death. Now taking a look at measles, as of May 2nd, there are 935 confirmed cases. 121 of those have been hospitalized. So that is 13%. One thing to note is that in the under 5 age group, about 1 in 3 have been hospitalized, so about a third. And it is notable that 93% of cases this year are outbreak associated. By comparison, last year, only 69% were outbreak associated. There have been 3 deaths so far in the United States, as well as 1 in Mexico associated with this outbreak. And that is 2 adults, 2 children total. And last year, the entire year, 2024, there were 285 measles cases. So already in 2025, we're not even halfway through, but we've already had over triple the number of measles cases that we saw the entire year of 2024. So at this point, 935 confirmed cases. These are across 30 different jurisdictions. And as I mentioned, 93% of those are outbreak associated. So those are from a total of 12 different outbreaks so far. And unfortunately, things don't seem to be slowing down, making it important for all of us to know if we are in an area of an outbreak, and if so, what to do about it. So on the CDC measles page, they've unfortunately had to add this section here called Resources for Communities with a Measles Outbreak. So if you happen to be in a community with a measles outbreak, I'd strongly suggest taking a look at these resources. There's a sample community letter just to raise awareness about the fact that there's a measles outbreak and what to do about it. There's also a whole toolkit about how to be ready. There are infographics like this one here saying there's a current outbreak of measles. So these can be printed or made into posters or whatever. And it goes over all the basic things that you need to know. It also has an infographic on what to do if you think your child has measles. It also has a treatment overview for providers. So I put the link to that measles page in the post if you want to check that out. And now I'm going to talk a little bit about asthma and COVID before turning it over to my co-host Monique. So the story of COVID and asthma, I think, is pretty interesting. And if you've been watching the briefing since way back when, or if you or someone in your life has asthma, you might remember that early on we were very concerned about people with asthma being at high risk for severe disease. And there was good reason for that worry, and that is because respiratory viral infections are one of the most common triggers of asthma exacerbations. And asthma exacerbation is basically when the symptoms of your asthma get worse and harder to manage, and that may require urgent medical attention. So, most of the other viruses that I mentioned just today in today's briefing, like rhinovirus and influenza, and RSV, these are all very well known to trigger asthma exacerbations. And not only that, but it's kind of a two-way street with asthma and respiratory viruses, where not only do these viruses cause asthma to get worse, but getting those viruses may even predispose you to later developing asthma. And in fact, that is the case with RSV as well as other infections, where if you get them early in life, they have been shown to predispose people to later developing asthma in children. So we really didn't know what we were going to get when SARS-CoV-2 came on the scene, but we definitely were concerned. So early on, we wanted to know, first and foremost, are people with asthma more likely to have a bad outcome from COVID? And then secondly, and I think this question came out later, is getting COVID going to predispose you to later getting asthma as well? So on the first question, as it turns out, SARS-CoV-2 is much less associated with asthma exacerbations than other respiratory illnesses. And so this kind of goes along with the notion that SARS-CoV-2 is a lot more than a respiratory infection. It is it causes an inflammatory response in the body that can affect any and all organ systems. And so it does manifest differently in many ways than other viruses that are transmitted by the respiratory route. And so it is certainly interesting that it turned out that SARS-CoV-2 was not particularly associated with asthma exacerbations, especially in people with well-controlled asthma. So it is important to note that patients with more severe asthma or patients who do not have their asthma controlled are at higher risk of hospitalization or death from COVID. So really the most important thing when it comes to asthma in general is that it is well controlled, but certainly in terms of the risk from a COVID infection, well-controlled asthma does not seem to put that patient at increased risk of a bad outcome. So that was a very big relief. And it also helped to focus our attention on making sure that people with asthma continue to take their medications, continue to keep their asthma under control. And if this topic is of interest, there's an excellent overview of asthma in the era of COVID-19 published in Respiratory Medicine that I have linked in the post. Now, as far as the second question, does getting COVID then predispose you to later getting asthma? Well, this is one I think we're still figuring out, right along with all of the other post-COVID effects that we see that can affect literally any system in the body. But today I'll briefly review a large study that tries to get at this question. And this study was published in the Journal of Allergy and Clinical Immunology in January of 2024. And it's called Increased Risk of New Onset Asthma After COVID-19, a Nationwide Population-Based Cohort Study. So as I mentioned earlier, we've seen that other viruses like RSV, rhinovirus, human metapneumovirus are associated with an increased risk of new onset asthma, particularly in children. And so this study was looking at whether this may be the case with SARS-CoV-2 and whether this may be the case in adults. So this is a nationwide study from Korea where they have a national health insurance claim-based database. So we know that these are not perfect, but we like them because they are massive and they cover an entire population. And in fact, the National Health Insurance Service covers about 97% of the Korean population, so approximately 50 million people. And their data includes all the things we would want to look at, from the demographics to the socioeconomics to how they use the healthcare system and details about any diagnoses they have, medications or treatments or procedures they've had. So this is pretty amazing from a research perspective, let alone from a universal coverage perspective. So what they did here was construct 3 different studies in one. The first was looking at people with COVID and a control group that is matched. So remember, they try to match people up as evenly as possible, like with all those variables that I mentioned, demographics and socioeconomics and diseases and things like that, to reduce the number of different variables. So study 1 was looking at people who were diagnosed with COVID and their matched controls. Study 2 was COVID-19 vaccinated individuals and their matched controls. And study 3 was vaccinated individuals and their matched controls, but they excluded people who had been diagnosed with COVID-19. And here is what they found. In study 1, they found that those with COVID had more than double the odds of developing new onset asthma compared to the matched group without COVID. In the second study, the vaccinated group was at a lower risk of new onset asthma compared to the non-vaccinated group. And in group 3, where they looked at vaccinated and unvaccinated without a COVID infection, there was no change in the risk of new onset asthma. So getting a vaccine in and of itself did not increase or decrease the risk of asthma for those who didn't get COVID. So the increased risk of asthma was only seen for those who got COVID, and that risk of new onset asthma was lower in the vaccinated groups. And among the folks who had that higher risk of asthma and got asthma in the COVID group, the risk was higher in older individuals and also in those with type 2 diabetes. And they were looking specifically at individuals who were diagnosed with COVID-19 at least one time between October 2020 to December 2021, so about a 15-month period. And this ends up including about almost 8.5 million individuals, so very large study. And with all 3 studies, they had a follow-up period of 6 months. And so again, during that 6-month follow-up, what they found specifically is 1.6% of the COVID group compared to 0.7% of the control group who didn't get COVID developed new onset asthma. So 1.6% in the COVID group, 0.7% in the non-COVID group. So basically there was more than double the risk, or actually 2.1 times the risk of developing new onset asthma after COVID. So these are not people who had pre-existing asthma. These are people who got new onset asthma after COVID. And unfortunately, we have seen a fair bit of this new onset asthma in adults, or adult onset asthma following COVID. And again, in study 2, slightly lower risk of developing new onset asthma after the COVID infection was seen in the vaccinated group. So vaccine appears to be protective here. So this is the largest, most comprehensive study evaluating the risk of new onset asthma in adults following COVID that I was able to locate. And the 2.1 times higher rate of new onset asthma compared to those without COVID is significant. It is interesting that the risk of new onset asthma after COVID was especially higher in older adults. It's not completely clear why. In fact, as I mentioned earlier, the connection between getting a virus and then developing asthma later has been much more clearly laid out with other viruses with children. So this is certainly different and interesting, and we need to learn more. Also, not clear to me why the risk is higher in those with type 2 diabetes. So we clearly have a lot to learn. We know, again, that this virus causes inflammation, causes issues within the blood vessels. So I think we need a lot more research to really understand what the cause is specifically is, but there's no question that there is an association here. And given how many COVID infections people are experiencing all the time, it's really important that we are on alert, that we know about this. that we even know that there's such a thing called adult onset asthma, because I think a lot of people think that this is something that you have diagnosed when you're a child and then you end up with it for life. And that is what we are mostly accustomed to. But there is such a thing as adult onset asthma, and COVID can be a predisposing factor to developing adult onset asthma. So this is something you should be aware of. This is something clinicians and caregivers should be aware of, because we have seen that after COVID, people get a chronic cough and then just kind of blow it off, but we don't want you to blow it off. If you are having a chronic cough, if you're having shortness of breath or wheezing, like that whistling sound when you breathe, or other respiratory symptoms after COVID, please don't just brush it off. If you start having coughing, whether that's coughing at night or coughing when exercising, or maybe it's increased mucus production that's causing coughing, and or even chest tightness or even chest pain, or again the whistling sound and breathing. These are all things that we want you to get evaluated, and just know that asthma is not limited to people who develop it in childhood. It can come on in adulthood, and COVID can be a predisposing factor. And so, on that note, I am pleased to pass it over to my co host, Monique Campbell, Clinical Programs Manager at Roots Community Health, to talk to you about all things asthma.
Thank you, Dr. Noha. And hello, everyone. Thank you for joining us during Asthma Awareness Week, a time to spotlight a health condition that often goes undiagnosed, untreated, and therefore unspoken. Asthma, and the profound ways it affects our East Oakland community. Let's start with what we've observed here at Roots. Over the past year, we've served 664 individuals managing asthma in our clinical program's Breathe Oakland Asthma Program. Looking at the past 3 years, a concerning trend emerges. Youth aged 15 to 19 comprise 37% of our asthma cases, followed by young adults aged 20 to 24 at over 27%. Even children as young as 5 to 9 account for over 14% of those diagnosed. But asthma isn't confined to the young. Nearly 40% of our adult asthma patients are between 55 and 69 years old, and 30% are between 40 and 54. This wide age range underscores that asthma affects all ages, and our community conditions exacerbates its impact. Let's also zoom out and take a look at the national landscape, because what we're seeing in East Oakland is a part of a much larger picture. According to the American Lung Association, as of 2022, approximately 44.2 million Americans, or 13.5% of the U.S. population, have been diagnosed with asthma at some point in their lives. Adults aged 18 to 55 show the highest lifetime prevalence at 16.8%. When looking at current asthma rates, adults aged 18 to 44 make up 9%. Adults aged 45 to 64 make up 8.9%. And adults aged 65 plus make up 7.9% currently living with asthma. Asthma's impact extends beyond health. It affects daily life. Among children, asthma is the leading cause of school absenteeism, accounting for more than 13.8 million missed school days each year. For adults, asthma contributes to 14.2 million lost work days annually, making it the fourth leading cause of work absenteeism. Too many East Oakland residents are undiagnosed or misdiagnosed. Asthma symptoms like chronic coughing, wheezing, and shortness of breath can mimic other conditions like COPD. Fear, stigma, and mistrust of the healthcare system often prevent people from seeking care. And so at Roots, we've identified a strong link between substandard housing conditions and asthma. Over 90% of the people we've helped with asthma lived in rented units. We've received multiple reports of black mold, asbestos, pests, and other environmental hazards, conditions that are not only violations of housing codes, but direct threats to health. Our environment plays a significant role. East Oakland's air quality is compromised due to industrial pollution, heavy traffic, and other factors. But it's not just what's outside that harms us. Indoor air quality is equally important. Many people don't realize that things like incense burned without ventilation, hookah use, harsh cleaning chemicals, scented candles, pet dander, perfume, and even smoke from unventilated kitchens all contribute to unhealthy indoor air, especially for those already vulnerable. So when should you get screened? If you or a loved one experiences persistent coughing, wheezing, shortness of breath, or chest tightness, especially at night or after physical activity, get checked. Early diagnosis can make a world of difference. Treatment options are available and effective. We offer personalized asthma coaching to help individuals understand their condition, identify triggers, and advocate for healthy housing. Whether it's preparing tenants to talk to their landlord or intervening on their behalf, our team is here to fight for your right to a safe home. We also use pre and post tests to help people understand their progress in managing their condition. Asthma isn't just a physical condition, it carries emotional weight. And many people feel that having asthma makes them appear weak. And we see individuals, especially young people, pushing themselves beyond their limits to prove they're not fragile. But here's the truth. Some of the world's top athletes have asthma. It's a condition, not a limitation. And with proper management, you can lead a full, active life. Unfortunately, myths persist. Children are being pulled out of physical education, excluded from class activities, and left on the sidelines, not because they can't participate, but because people assume they can't. This stigma causes real harm, leading to isolation and hindering development. That's why we're just not treating asthma. We're building a movement. At Roots, we believe everyone deserves to breathe easy. That means diagnosing asthma early, treating it properly, and fighting for safe housing and clean air for all. So during this Asthma Awareness Week, take a deep breath, not just for yourself, but for your neighbor, your elder, and your child. Let's keep breathing. Back to you, Dr. Noah.
Thank you so much, Monique. Let's keep breathing together. I love that. For more asthma tools and information, please follow us at Roots Empowers on Instagram and Twitter or X, and Roots Community Health on LinkedIn and Facebook. We will be sharing all week in honor of asthma awareness. And speaking of sharing, our amazing team also developed this very short video, which contains all the things that I usually close out the People's Health Briefing with. So here you go. And this concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you next Tuesday at 10 a.m.